Hi, this is Dr. Silvester. I'm going to talk to you a little bit about probably the first or second most common thing we see in our office, and that's patients with ingrown toenails. We love those patients because most of the time we can help them very quickly and very easily, and they're always happy when they leave, at least 90% of them. If you're afraid of getting the injection, if you're afraid that it's going to hurt a lot, every week we hear horror stories about patients who have had injections in their toes where they've been extremely painful. Patients can't tolerate it. If they've been to other places and they're coming in to see us, they are usually very reluctant to come in because they've had bad experiences elsewhere. I want to just kind of try and put your mind at ease a little bit, because we use about 5 different techniques that make the pain much less than it would otherwise be. I'm going to kind of run through those. First of all is the anatomy of the toe. If you know where to give the shot, it's a lot less painful. Second thing is the use of sodium bicarbonate in the local anesthetics, because local anesthetics are all acid-based, and so when you're giving an injection, it hurts. If you use sodium bicarbonate, it hurts a lot less because it neutralizes the acid. The third thing is we use the smallest needle that's kind of commercially available. We use a 30-gauge needle, which costs about twice as much as other needles. So it's a little more expensive, but a lot more comfortable. The other thing that we do is just the technique of giving the injection. There are certain ways to make the injection a lot less painful by just the technique of doing it, and so we train our staff in giving those injections in a painless way. And also the last thing is we use cold spray, which is, some people argue that stings, which it does. It does sting a little bit, but it doesn't allow you in general to feel the needle going into the toe, and people prefer the sting of the cold spray to the sting of the needle. Bottom line is I've done that procedure, given that shot to 3-year-old, 4-year-old kids, and they haven't given me too much trouble if they'll cooperate with us. So if a 3 or 4-year-old child can take it, it should be okay for you to have it done, and there's no need to fear too much. We'll try to make it as pleasant an experience as possible. And by the way, everyone in our office has experienced that injection, which is kind of part of our training. So we also have great empathy for the patient if they're coming in to get the shot. We try to understand what they're going through a little bit. Thank you.